The hidden crisis: how medical bills and insurance premiums are silently bankrupting average American families. You know what nobody talks about at dinner parties? The fact that one unexpected hospital visit could completely obliterate your family's financial future. I'm not talking about losing some savings or dipping into your emergency fund. I'm talking about complete and total financial devastation. And the wildest part? You probably have insurance.
Let me paint you a picture. Sarah is a 34-year-old teacher. She's got a master's degree, a steady job, and what she thought was decent health coverage through her employer. Last year, her son broke his arm during soccer practice. Nothing crazy, just a clean fracture that needed surgery and a cast. 6 weeks later, she got a bill for $18,000. $18,000. And yes, she had insurance. Her out-of-pocket maximum was supposed to protect her, but between the deductible, the copays, the out-of-network anesthesiologist she never consented to, and a dozen other charges she couldn't decipher, her family went into debt that will take them years to pay off. This isn't an isolated incident. This is America in 2025. And if you think you're immune because you're young and healthy or because you've got a good job with benefits, I need you to understand something critical. The system isn't broken. It's working exactly as designed. It's just not designed for you. Here's what's really happening. The average American family is now spending over 22% of their household income on healthcare costs. 22%! That includes insurance premiums, deductibles, co-pays, and all those other fees that seem to multiply like rabbits. To put that in perspective, the average family spends less on food. Think about that for a second. We're spending more to stay healthy than we are to stay fed. But wait, it gets worse. Those premiums you're paying, they've increased by over 300% in the last 2 decades, while wages have barely budged. Your paycheck might be slightly bigger than it was 10 years ago, but after you factor in what's being automatically deducted for health insurance, you're actually taking home less money. And that's before you even use your insurance. The deductible scam is perhaps the most insidious part of this whole operation. Insurance companies have figured out a brilliant way to take your money every single month while providing essentially nothing in return for most of the year. The average deductible for an employer-sponsored family plan is now over $5,000. That means you're paying hundreds of dollars every month in premiums. And then, if something actually happens, you're on the hook for the first $5,000 before your insurance even thinks about helping you out. Do you know what that creates? It creates a bizarre reality where people with insurance avoid going to the doctor. They skip preventative care. They ignore symptoms. They ration their medications. Because even though they're insured, they can't afford to actually use their insurance. We've normalized the idea of GoFundMe campaigns to pay for cancer treatment. We've accepted that medical debt is the leading cause of bankruptcy in the wealthiest nation on earth. This is insanity. And the healthcare providers aren't innocent victims in this system either. Hospital pricing has become this completely opaque nightmare where nobody knows what anything costs until after the fact. You could call 10 different hospitals and ask how much a specific procedure costs, and you'll get 10 different answers, ranging from $500 to $15,000 for the exact same thing. Often, they won't even give you a number. They'll tell you it depends on your insurance, your specific plan, whether the doctor is in network, what time of day it is, and apparently the phase of the moon. This deliberate opacity serves a purpose. It prevents you from shopping around. It prevents you from making informed decisions. It keeps you dependent on a system that profits from your confusion. Imagine going to a restaurant where they won't tell you the prices until after you've eaten, and then they bill you 3 months later with a bunch of random charges you can't verify. You'd never go back to that restaurant. But with healthcare, you don't have a choice. The pharmaceutical industry deserves its own special recognition in this disaster. Americans pay 2 to 3 times more for the exact same medications as people in other countries. The same insulin that costs $35 in Canada will run you $300 in the United States. Same drug, same manufacturer, same everything. The only difference is that in America, pharmaceutical companies are allowed to charge whatever they want, and insurance companies negotiate secret deals that keep prices artificially inflated while shifting costs to you through higher copays and coinsurance. Then there's the prior authorization nightmare. Your doctor, who went to medical school for nearly a decade, says you need a specific treatment or medication, but some person working for your insurance company who's never met you and is reading from a script gets to override that decision. They can force you to try cheaper alternatives first, even if your doctor knows they won't work for your specific condition. This isn't medicine. This is bean counting with your health as the collateral damage. The middlemen in this system are making obscene profits while producing zero value. Pharmacy benefit managers, those companies you've probably never heard of, are raking in billions by negotiating drug prices and taking cuts at every stage of the transaction. Health insurance executives are pulling down 8-figure salaries while denying claims and finding creative ways to avoid paying for the care you've already paid them to cover. Hospital administrators make more than the doctors actually treating patients. The whole system is designed to extract maximum profit from human suffering. And let's talk about what this is doing to the middle class specifically. If you're wealthy, you can afford concierge medicine, the best specialists, and you never worry about bills. If you're poor enough, you might qualify for Medicaid, which actually has better coverage than most employer plans. But if you're middle class, you're trapped in this nightmare zone where you make too much to get help, but not enough to actually afford the system you're forced to participate in. Middle-class families are making impossible choices every single day. Do we fill this prescription or buy groceries? Do we take the kid to the emergency room or wait to see if it gets better on its own? Do we get the recommended cancer screening or pay the electric bill? These aren't choices people should have to make in a functioning society, let alone in the richest country in human history. The psychological toll is immeasurable. The constant anxiety of knowing that one medical emergency could destroy everything you've worked for. The shame of having to choose between your health and your financial survival. The frustration of fighting with insurance companies while you're sick, trying to get them to cover things they're supposed to cover. The exhaustion of navigating a system designed to confuse and overwhelm you. Young people are looking at this system and making rational decisions that previous generations would find shocking. They're staying on their parents' insurance until they age out at 26, then going without coverage because they literally cannot afford it. They're delaying having children because they can't afford the cost of pregnancy and childbirth, which can easily run into tens of thousands of dollars even with insurance. They're turning down job opportunities because they can't risk changing insurance plans while managing a chronic condition. The system is actively preventing people from living full lives. Small business owners are getting crushed particularly hard. If you want to start a business or work for yourself, you better hope you're healthy because individual market insurance plans are brutally expensive and offer worse coverage than employer plans. This creates a perverse incentive where talented people stay in jobs they hate just for the health benefits. We've essentially created a form of soft employment bondage through healthcare. The retirement crisis that nobody's talking about is directly linked to healthcare costs. People are working well into their 70s, not because they love their jobs, but because they need employer health insurance to bridge the gap until Medicare kicks in at 65. And even Medicare isn't free. It comes with premiums, deductibles, and significant gaps in coverage that require supplemental insurance, which of course costs more money. The dream of retiring at a reasonable age and enjoying your golden years has been effectively killed by healthcare costs for millions of Americans. Meanwhile, every other developed nation has figured this out. They've created systems where people can see doctors without fear of bankruptcy, where medications are affordable, where having a baby doesn't cost more than a new car, where cancer treatment doesn't mean losing your house. And they're doing it while spending less per person than we do. Less money, better outcomes, healthier populations. But somehow we've been convinced that it's impossible here. The propaganda is relentless. We're told that universal health care would mean long wait times, as if millions of Americans aren't already avoiding care because they can't afford it. We're told it would mean worse quality care, even though we rank below dozens of other countries in actual health outcomes. We're told it would mean losing your choice of doctor, while insurance networks already restrict your choices and can change at any time without your input. Every argument against reform falls apart under the slightest scrutiny, but they keep working because people are scared and confused. What makes this even more infuriating is that we already have examples of better systems within our own country. The Veterans Affairs healthcare system, Medicare, Medicaid, these programs have higher satisfaction rates and lower costs than private insurance. They're not perfect, but they prove that a different approach is possible. Yet we continue to funnel endless money into a privatized system that serves shareholders instead of patients. The solution isn't tweaking around the edges. It's not another marketplace or another tax credit or another high-deductible health plan with a health savings account. Those are Band-Aids on a gunshot wound. We need fundamental restructuring of how we think about healthcare in this country. Healthcare is not a luxury product. It's not something that should be subject to pure market forces. When you're having a heart attack, you're not in a position to negotiate prices or shop around for the best deal. Every single day, regular people are making the choice between financial security and their health. That's not a choice anyone should have to make. And every single day, the middle class is being hollowed out by a system that was supposed to protect them. Insurance and healthcare costs are the silent destroyer, the slow bleed that's draining the economic vitality of millions of families. They're working harder than ever, earning more than their parents did nominally, but falling further behind because healthcare is devouring their income. This isn't sustainable. A society cannot function when its people are one illness away from poverty. An economy cannot thrive when families are drowning in medical debt instead of investing in their futures, starting businesses, or buying homes. A democracy cannot survive when people are too sick, too stressed, and too broke to participate fully in civic life. We're watching the foundation of the middle class crumble in real time, and healthcare costs are one of the main sledgehammers doing the damage. The question isn't whether this system is failing. The question is how much more failure we're willing to tolerate before we demand something better. How many more families need to be bankrupted? How many more people need to die because they couldn't afford care? How many more generations need to have their futures mortgaged to pay for the profits of insurance executives and pharmaceutical CEOs? At some point, we have to decide that we deserve better, that our neighbors deserve better, that this country can do better. Because right now, while we're all paying attention to 1,000 other things, insurance and healthcare costs are quietly, methodically destroying the middle class. And if we don't wake up and do something about it soon, there won't be a middle class left to save.